Creating a lifestyle that helps promote good health can be challenging for many of us, but Corewell Health, the new name for Spectrum Health, is making it easier by offering a program called Lifestyle Medicine. It not only helps people live their healthiest and best lives, but it teaches them simple changes in their diet can actually prevent or even reverse chronic diseases. Here to tell us more about this program and help people get started on a path to better health, Dr. Christy Arts. She's emergency medicine physician and medical director of Lifestyle Medicine at Corewell Health. Welcome. Thanks so much for being with us.
Thanks for having me. Good morning.
Good morning. So tell us a little bit about lifestyle medicine, what exactly that means, and why this is important for all of us.
Well, as you probably realize, many people are thinking about, New Year's resolutions, trying to get healthier in the new year. Well, lifestyle medicine is a medical specialty, and we apply the therapeutic use of lifestyle change. So things related to your diet, physical activity, sleep, stress reduction, all of this in the effort to both prevent chronic disease and sometimes even use it as treatment, or to even help reverse many common chronic diseases, things like type 2 diabetes, cardiovascular disease, even some autoimmune conditions like multiple sclerosis or rheumatoid arthritis respond incredibly well to using therapeutic lifestyle interventions. And the reason that this is important is because the daily habits that we adopt, that we follow day by day, whether it's how we eat or how we move our bodies, again, how we manage stress and obtain restorative sleep, these are really the foundations to our health. Most chronic diseases are actually related to chronic inflammation. So when we use these types of lifestyle changes, we can actually get at the driving cause or the root cause of many of these common chronic conditions.
Wow. And, it makes perfect sense, but it's something that maybe we don't explore quite enough. How can someone get involved in this program, and then how does that work down the road for them?
Well, it certainly depends on any individual's current medical conditions, the goals that they have, their health goals that they have in mind, and of course also partnering with their primary care physician. It also often involves the family. If you have other members of the family that you live with, any lifestyle change that an individual makes will oftentimes impact in a positive way many other family members that you might live with. So getting involved in lifestyle medicine oftentimes will begin with a visit with one of our specially trained and certified lifestyle medicine physicians. We also have certified health and wellness coaches on our team, registered dietitians, even chefs. So when you're thinking about using food as medicine, we have several food as medicine type programs that you might get involved with if you're looking to better manage chronic conditions or also prevent them. We have excellent culinary staff that can help you learn how to cook differently, make your meals taste delicious as well. And then, of course, focusing on other health behaviors like exercise, physical activity, the importance of strength training as you're trying to build and maintain healthy muscle as you age.
And you keep talking about using food as medicine. Tell us how that works and how you've seen it in action really change people's lives.
Yeah, it's really amazing. When we look at the standard American diet, it is now the single greatest risk for death and disability related to chronic disease in this country. So food is truly the building block to health. And many individuals that we see and treat in lifestyle medicine respond dramatically to oftentimes small incremental changes that we can empower them to make and help them make in their diet. Of course, most people understand that eating more fruits and vegetables is good for them, but it's not always easy to do. And certainly trying to find new ways to do this in sustainable fashion. Again, working with our team, whether that's our health coaches or some of the chefs on our team, and of course our knowledgeable registered dietitians, those can all be great ways that we can help a person use food to really be the best medicine in terms of disease prevention and sometimes treatment and reversal.
Absolutely. All right, Dr. Arts, that's such a fascinating program. I love it. If people want more information, what do they need to do?
You can call our office directly. You can go to our website, learn more about the different programs that we offer. We oftentimes will see patients upon referral from their primary care doctor or another specialist they're seeing, or some patients choose to self-refer. And as I mentioned, you'll oftentimes start with a visit with one of our lifestyle medicine certified physicians, and from there we'll help design the best path and program for you to meet the goals that you have in mind for 2023 to have better health.
I love that, giving people control of their own health care. Dr. Arch, thank you so much for your time this morning.
Thank you. Have a great day.
We'll be right back.